Hey guys, welcome to this week's a little later episode of Chewing the Fat with myself and Dean Kilby. This week we're going to be talking about something different, a little bit off topic from protocol and weight loss and all that sort of thing, although it may intertwine. We're going to have a look at the regenerative medicine side of things. A few years ago, Dean threw some stem cells, my own cells, into my knees. When I say threw them, he injected them.
I threw them in.
Just chuck them in there. And there's been, I get a lot of questions about that and how my knees are now, and what was involved and how much is, and can you still do it? And there's been ups and downs in what has been available and why and all that sort of thing. So we thought we'd go through that a little bit today. What's the good evening, first of all. Thanks for joining me on the call.
Yeah, well, I mean, we're a little bit later because I had something better to do on Sunday night. Apparently, I need to have a life as well.
But make the time.
I do. I got to tell you, I started feeling like just exhausted, and I'm just doing so much. And my next door neighbor is just a phenomenon. So my next door neighbor, he's a martial artist, and he's claimed to fame. When I said to him, what was the highlight of your martial arts career? Because this guy, he's got, I think he's like 5th or 6th Dan black belt in 5 different disciplines.
Yeah, right.
And I said to him, what's been the highlight of your martial arts career? And he said, he said, Chuck Norris punched him in the guts and winded the shit out of him. that was like a real honor. And I'm like, oh my God, you got beat up by Chuck Norris? And he goes, no, I kicked the shit out of him. But he landed, that was an honor to have one landed on me. And anyway, so this guy's amazing. He holds 2 Guinness World Records. His name's Glenn Coxon. And Glenn was going through cancer treatment. He was diagnosed with advanced cancer, some kind of neck cancer. And anyway, it was amazing how he went through it, and he managed his nutrition vigilantly, and his partner, his wife, and he were amazing in how they went about that. They followed the doctor's orders, but they also did their own research and were just really vigilant about that. And he made a decision at some point that he wasn't going to be defined by this cancer. Right. And so he said, I need to take the focus off the cancer. So I don't want to be dwelling on that all the time. So he declared that he was going to break a world record. So he now holds 2 Guinness World Records. One is for the most number of wooden boards broken in 1 minute. How many? 60 seconds, right? How many boards do you reckon you can break in 60 seconds? It's like 370 or something. Yeah. It's ridiculous. Yeah. And then he holds the Guinness World Record for the fastest time to break, I think it was like 1,000 boards or 3,000 boards or something. I don't know. I can't remember. Yeah. But anyway, he still, he survived the cancer, and, he still trains people and stuff. So I started to notice just how, I don't know, everything that I do, it's all like for everyone else. My entire week, I'm coaching people, I'm designing and trying to get certain businesses off the ground that contribute to the greater good, or I'm driving the kids around, or cooking or cleaning, or it's like, man, I've got to do something for myself. And, with a commitment to being well, man, I've got to look after this skin bag here as well. So I've asked him to train me.
Oh, really?
Yeah. I'm going to have this like freaking ninja training me. I'm terrified, man. I did a push-up back in 2004. I don't know if I'm still recovering or it's just extended rest periods in between sets.
It's not hard. If you can do one, you just keep doing them.
I know. That'll be fun. It'll be fun, and toughen up. I'll know some fancy martial arts moves.
Got to get all the Bruce Lee.
You got to do stuff.
The most important part of martial arts training is getting all the Bruce Lee quotes down.
Yeah. I'll have some profound sort of Shaolin monk type things to contribute at the next one, I'm sure. Next Chewing the Fat. I look the part, I may as well act it, right? Yeah. But, that's what's going on for me. And so regenerative medicine. So, this is a topic everyone's asking about stem cells, and people ask me, am I still doing stem cell research? And look, I'm a molecular cell biologist by training. So I was sort of formally trained in what seems like a past lifetime ago in cell biology. But I didn't really do stem cell research as such. I helped to pioneer opportunities for patients to access these types of therapeutic approaches now, not in 20, 30, 40 years time, when everyone says, when we know more, when we understand this more, there's this weird conundrum. Yes, we need to have a really good, clear understanding of how things work, so things are predictable and we can mitigate risk. But it hinders progress. The irony is, you take paracetamol, for example, Panadol, you got a headache, you take, we don't know how that shit works, really?
Really?
There's so much we don't know. We just take it for granted. Like we've got an idea, and there's some, evidence to suggest, but really there's a lot of unknowns around these kinds of medications, but they're safe. So we just continue to take them. So long as you don't take it in excess. It screws with your liver if you do. But there's, amongst human beings, just generally, whether it be, scientific related stuff or just anything in life, unless you understand it, then it must not be valid. Right? And people have this arrogance, like, well, I don't understand it. And, sometimes they say things like, I don't believe it, or I don't agree. What they're really saying is, I don't understand it, so therefore it must not be valid. And until you can make me understand it, then it's going to remain invalid, which is stupid, because, who cares about all the evidence for that something works, but if we don't understand it, so that's kind of like part of the dilemma with regards to making these kind of treatment therapeutic options available for people using various regenerative medicine techniques. So my introduction to regenerative medicine was a number of years ago. I had some pretty bad back problems. And back then I used to work for a pharmaceutical company in the strong opioid market. So we were dealing with chronic pain problems, and the target market for these certain opioid products was elderly patients with osteoarthritis. And often it was just not appropriate, or doctors didn't know how to prescribe these drugs properly. Anyway, I found myself in this one situation, giving a presentation to a bunch of doctors. I think there was about 15, 16 of these doctors. They call them physical medicine doctors. So they're general practitioners, but they have a special interest in musculoskeletal disease. And it's a unique kind of diagnostic process. Their interest in ligament laxity and joint instability, and they're trying to correct the biomechanics of joints, and what are all the various structures and interplays of those structures that contribute to malalignment of joints, which then contributes to wear and tear and pain. So I'm giving this presentation. I said to them, it's no mistake that I'm here before you, because I was talking about the use of strong opioids in chronic back pain. And I said, I deal with back pain problems myself. And they all laughed and said, we can tell just from the way that I was standing and how I walked. And anyway, they had a hands-on component the next day, and they invited me to come back into their workshop, and they said that they could fix me, which kind of pissed me off, because I'd been dealing with back problems since I was about 15 years of age, and no one's been able to make any kind of difference. And a number of chiropractors and an osteopath and physios and drug treatments and all this kind of stuff, various exercise routines, and nothing had really been able to make a difference to my back. So I go to this workshop, and they checked out my whole body, and then they asked me this one question: what happened to your right ankle? And I said, like, my right ankle? I don't know, nothing. And they go, no, something happened. Like, have you injured it before? I said, oh yeah, I've sprained my right ankle before. And they said, how many times? And I said, I don't know, I've lost count. They said, when was the first time? And I remember it. I was in grade 5. I was 10 years old, and in Bendigo, on the Bendigo showgrounds, we were playing softball. It was part of school. And I'm going to name some names just because it's so vivid for me. I hit the ball, and I'm running in between bases, and I went to slide into third base, and Greg Goodman, I have no idea what that guy's up to these days, but I remember it was this, for a kid, he was a big guy and redhead, and he was on that base, and he put his foot down right in front of me where I was sliding, and my foot was like that instead of like that. So I hit his foot, and I flipped all the way over, and I just ripped all the ligaments in my ankle. I remember it hurt so damn bad that I knew it hurt so much I wanted to cry, but I wasn't crying. So I was putting on this really weird fake cry, and everyone had gathered around, and then I started getting embarrassed. And anyway, it never healed properly. So I then had an unstable joint, and there was a 7-kilogram weight discrepancy to my left, and that affected my gait, how I walked, how my foot hit the ground when I walked, how it transferred the energy throughout my body, the influence that had on other muscular systems and structures that had to then compensate. And then I would get overloading. And so when you get muscle overloading, you get like muscle striations, should look like that, but you get these knots. And, you get a massage, but some of these knots, we call them trigger points. They're painful to palpate, to touch them. And you can't massage them out. They're so freaking deep. And anyway, that just skews everything. So what happens when the muscle's got all of these trigger points, it shortens the muscle. It's always under stress.
Right.
And where the muscle inserts onto the bones, like in the tendons and so forth, you get these micro tears. And it said those tears, that causes a lot of pain. Right. And then any kind of trauma, whether it be physical or even psychological, it increases those tears and the resultant pain. Wow. And, becoming a young adult and moving to Sydney and dealing with the stress of the postgraduate research I was doing and financial hassles and everything, what used to happen back then is, particularly around money, when I would get stressed around money, my back would go out. And so when I'd get stressed, what would happen is my spine would torsion, and it would just make everything a hell of a lot worse. So this was explained to me, and this doctor was able to use medication, injection techniques, stretching, and physical manipulation. He was skilled in all different modalities. Yeah. People can check him out. He's Dr. Philip Lim. He's based in St. Leonard's in Sydney. Northside Physical Medicine is the practice. Anyway, he says to me, I can fix you, but it's going to be a process of a good 8 to 9 months. And he was right. It took like 8 months. And those trigger points, injected them with 1% lignocaine, an anesthetic in saline solution, and it would kind of relax the muscles, and then he would do proprioceptive neuromuscular facilitation, or PNF stretches.
Yeah, right.
And that kind of helped free me up, free some movement up. My shoulder was a bit messed up. I couldn't move it properly. I couldn't lift my arm and get it down properly, and it had rotated forward. And so he injected that joint with a solution that just kind of blew the joint out, and then it just went back into its normal position.
Yeah, wow.
We call that hydrodilation of the joint. And then where there were micro tears, he took 20% dextrose in saline solution. So basically just some glucose in water, and injected right into where it was painful. And what that glucose did, it was like an irritant, started to irritate the cells, and it caused a very local inflammatory response. So what happens when you have inflammation in those acute situations? If, I just punch my arm, I break some blood vessels, the platelets in my blood will stop the bleeding. And then they recruit white blood cells to come in and clean up the mess. The white blood cells are any pathogens that we need to take care of as well. But then that local inflammatory response calls in the big dogs that come in and heal. So your mesenchymal stem cells and growth factors that can then heal, regenerate, reorganize the tissue. So that's the healing process. Right. So what would happen if you irritate those micro tears with that irritant, the body's natural healing processes would come in and it would heal it properly. Yeah, wow. And then it was just a process of getting out there, moving, hurting, chasing the pain, doing those injection techniques over a period of time. I just don't deal with back problems anymore.
Yeah, wow.
Like that was back in 2008. Yeah, it was amazing. And then my shoulder, all those years of problems and my structure wasn't right. I had inflamed tendons in my shoulder, and it was weak. And even when I would get it up, when I could get it up with my arm, when I'd lift my arm up, it was weird. I couldn't get my arm back down. I'd have to kind of manipulate my arm back down and make it comfortable to bring it. Now it's just moves freely.
Yeah, right.
And you can use another regenerative technique. What we did is you take your blood, your own. So these are just biological molecules. There's no drugs, right? Just simple injection techniques, no surgery, nothing. And you've got all the healing potential in your body. You just got to help it out sometimes. And you take your blood and you spin it, and you get like 55% of the volume is red blood cells. And then you get like what's called a buffy coat. They're the white blood cells. And then the rest is the plasma. In the plasma, in that tube, you've got a density gradient of platelets from low concentration to high concentration. Inside those platelets are growth factors. Mm-hmm. And these growth factors can help stimulate the healing process. So you extract that platelet-rich plasma, that fraction of platelets, and inject it straight into certain parts of the body. In my situation, it was in Associate Professor Justin Paoloni, who's a clinical colleague of mine. He's based down in Kogarah, and he's one of Australia's leading sports medicine physicians. And he injected my own platelet-rich plasma directly into that tendon.
Right.
Literally within a minute or 2 minutes, my arm was just completely freed up. It was amazing. No surgery, no drugs, nothing.
That's awesome.
It was incredible.
I think that's part of the problem too with the the medical side of stuff and the disagreement, and you were saying before about the not understanding of it. But there's got to be a threat there to billions of dollars worth of replacements or other treatments and stuff versus using your own cells to be able to treat yourself. Yes.
Yeah, absolutely. We used to do these treatments where you could use your own mesenchymal stem cells to treat various ailments, your cells to treat your body, especially when there was just nothing else available and your quality of life was suffering.
Yeah.
The government changed the regulations, so now your cells are regulated by the Therapeutic Goods Administration as a drug, basically.
So they should.
So you can't even. Sorry.
So they should be
So yeah, absolutely. Look, why? Well, there's the safety issues, of course. We want to regulate it and ensure that there's safety across the board and that no rogue doctor is taking advantage of the situation, all this sort of stuff, right? Sure. But doctors are regulated by their own governing bodies anyway. If you're a professional, you act like a dickhead, you get sorted out pretty quickly. Patients complain and the Australian Medical Association or the Australian Health Practitioners Regulatory Authority will come in and, ruin that physician's life. So that's enough of a threat for doctors not to piss fart around with this stuff. But you got to remember that these people participated or partook in that career because at least once upon a time, they had an enormous commitment to contribute and make a difference to people. And oftentimes when they're at the effect of the PBS and Medicare and their insurance and so forth and short consults with their patients, and they don't experience being able to make that difference to people. And when they're seeing their patients suffer, they just want to help them, right? So when these options are available, then, some doctors are smart enough to get trained properly and make them possible for those patients to access. So, and yes, it becomes a threat then to the pharmaceutical industry. It becomes a threat to the surgical community. It becomes a threat also to the basic research community. Can you imagine millions of dollars that the government invests in basic research? And some of these basic research organizations want to do basic research in the laboratory and generate patents. So then they can create biotech companies and have a monopoly on that technology. They don't want the government to be supporting and spending money on the clinical end just yet. Right? So it's everything gets, occurs to everyone as a threat. At the end of the day, who suffers is the patient, constantly being told, oh, we'll have this medical breakthrough and it might be available to people in 20 years' time. They've been saying that for the past 40 years. Where is it? Yeah. Well, it's in your body. It's in your body. So, you can go from those prolotherapy techniques using dextrose. Oh my God. When I was in Florida, what was this, 3 years ago or something? And I attended this Regenerative Medicine conference and a hands-on workshop where these doctors were just using 5% dextrose in saline, injecting nerves subcutaneously. So the nerves just under the skin.
Right.
And there was this guy who had tennis elbow. So he was a personal trainer and it impacted his career and, he couldn't work properly and stuff. So he had tennis elbow and he's in pain and so forth for, I think it was 9 years. And nothing had been able to help and make a difference. He hadn't been able to straighten his arm without pain or anything. And anyway, using ultrasound, they tracked the irritated nerve, inflamed nerve, and they tracked it using the ultrasound probe all the way up under here, where they then injected in his underarm that nerve with just 5% dextrose.
Right.
And literally, I watched this guy within seconds able to freely move his arm with no pain. And the guy was in disbelief. He was kind of like, he didn't want to talk. He was like, he couldn't believe it, just staring at his arm moving, wasn't in pain. And then, look, that will last for however long it lasts, and you've got to get repeat treatments done until it's completely freed up. And they were recommending something like between 3 to 6 treatments, right? Maybe a week apart. But it was amazing. It's such a simple thing where these medical technicians were just so good at what they were doing. And yeah, that was amazing. So anyway, that's another technique that was developed by another friend of mine from New Zealand, Dr. Liftoff is his name, John Liftoff. He developed this perineural injection technique, which is amazing. And I've had it done. I've used it on the back of my legs that would get really tight and make it difficult for me to walk sometimes. And 2 injections in just 2 discrete spots on my legs freed me up completely. And I was like, holy crap, this is incredible.
Taking me on these trips so I can jump in on the injections.
Totally, man. You just give yourself over to be the practice dummy. You get all these treatments.
Mate, I'll put my hand up for anything.
You do. You're the yes man. I swear to God, Jim Carrey made that movie about you. You're just open to everything.
So what's the go with the stem cells now? Can you still do it, or what's happening around that?
Not the way that I used to do it.
Right.
So I started off here in Australia. We would access your fat tissue. So you've got like an abundance of these cells, these regenerative cells in your fat tissue. And we used to dissociate that fat tissue, and then in the centrifuge, you spin it, and in the tube, oil floats on top of water. So the fat cells would be at the top, and at the bottom of the tube would be the regenerative cells. 10% of them would be the stem cells, right? Mm-hmm. And then would just take that, call it stromal vascular fraction, and inject that into the patient's joint, for example. And often would mix it with the platelet-rich plasma. So if you think of the platelets from your blood as the fertilizer, and the stem cells from your fat tissue as the seeds, put them together and inject it. That was unbelievably effective. And that was the treatment that you had. Yeah. So what is it now? 5 years on or something? Is it? Yeah. It's about 5 years.
Yeah. About 5 years.
5 years since we treated you, and your knees were pretty bad. I recall you couldn't squat. They were painful all the time.
Yeah, I could squat, but they'd crunch as I squat down, and I'd have to, at least the first couple of times, if I was, say, doing exercise or whatever, I'd have to help myself back up. But if it was just one-off type stuff, like if I was just walking along and, tied a shoelace or something, to get back up, I'd have to put my hand on my leg to push myself back up again because it just hurt too much in my knee. And same deal, that took, after I had that done, it was like probably 2 or 3 weeks, I started thinking, yeah, it's getting a lot better. And then it went through a phase of, it'd bite me every now and again. I go, oh, wow, that's weird. Yeah. And initially I thought, oh, is it working? Because I'm still getting bitten. But then I thought, no. That was like that all the time before, and I didn't get those one-off sort of hits. And then after another couple of weeks, it was gone.
Yeah. Yeah, there's just no evolutionary purpose for chronic pain. So, I mean, it's interesting hearing you share that, because it's like the chronic pain then became, like, it healed to the degree where you experience acute pain.
Yeah, right.
Right. And it was like, it was usually based on movement or something, but then that went away as well.
Yeah.
And that's the way regenerative techniques work. It's not like, you take a drug and it has an effect, and if you stop taking the drug, the effect goes away. Yeah. Regenerative medicine, there seems to be continual improvements over a period of time until it plateaus, and then you kind of like, you stay at that level. So that was the treatment that you got, and we used that to do a number of things. I coordinated the first, so there was a patient with Sjogren's syndrome who we injected the stromal vascular fraction, so again from her own fat, got these regenerative cells and injected it into the lacrimal glands of her up here,
right,
and also into the parotid and submandibular glands, so they generate saliva, and anyway, she had an autoimmune condition where she just didn't make all that stuff, no tears, no saliva in her mouth. And within 2 months, she had a wet mouth and she could cry, and she had snot in her nose for the first time in a decade. And it was amazing, right? And then, gosh, what else did we do? Diabetic wounds, patients with diabetes, they get these wounds that don't heal. And this one was amazing. You inject, because the limb, it's often on the lower limbs, and that's why diabetics, sometimes they get their foot chopped off, right? Because they get these wounds that just don't heal properly. And even if you use these vacuum technologies to help close the wound and encourage its healing, it doesn't, because there's no blood flow to it.
Right.
The blood vessels coming down your lower limb just, they die off. These cells that we can get from people's fat tissue, you inject them down the limb intramuscularly. They're angiogenic, which means they promote the growth of new blood vessels.
Right.
So then you get the blood flow down to the limb, to the wound, and you inject the wound and they close. I mean, I'm mates with a guy, Peter, sorry, his name escapes me. He's Dutch, and he lives in Naples in Florida now.
He did better than me. I wouldn't have remembered his first name.
That's going to piss me off now. I can't remember. But anyway, he's an expert in wound management, and he had 2 fully integrated clinics in the Netherlands where you take category 5 wounds. These are the gaping wounds, right? The close rate in those wounds in the literature across the globe is about 25%. In his clinic, the close rate of those types of wounds, category 5 wounds, was about 85%.
Yeah, wow.
He was so freaking good at it was just amazing. So, you can use those cells for that. And I went to Fiji a couple of times to meet with the government there. Fiji has the highest rate of diabetes-related amputations in the world.
Wow. 1
every 12 hours.
Yeah, wow.
So, and it's not like their surgeons do a good job of that either. So it's pretty harrowing. It might be a foot, it might be a whole leg, it might be a toe. It happens all the time, right? So diabetes is like 30% of the population in the South Pacific, and it's all dietary related. So if you don't eat properly, if you've got metabolic syndrome, you end up pre-diabetic. People think you can control diabetes with drugs, and yeah, we're better at it these days, but that doesn't take away the reality of the fact that you might end up on dialysis 3 times a week for 5.5 hours at a time because your kidneys are shot due to the diabetes. It doesn't take away the fact that you might lose parts of your body because of neuropathies and non-healing wounds. It doesn't take away the fact that the vascular damage in your eyes causes you to go blind. Or you have a myocardial infarction because you don't look after your diet, and you have a heart attack, and then your chances of getting diabetes within 3 years after your first heart attack dramatically increases. Mm-hmm. I mean, these things people don't take, they don't get the reality of it. Or you go to a dementia ward. It's not like people forget a few things. Go to, there's one in Rudy Hill. It's massive nursing home with this huge dementia unit, and they've got 4 levels. And you go to the high security level 4 of this dementia unit, it would make anyone just drop to their knees and start crying that this is an aspect of what humanity looks like, even in this country. It's just heartbreaking and gut-wrenching. And yeah. I remember a nurse was taking me for a tour around that unit. I don't even remember saying goodbye. It upset me so much. I think I just walked out and went straight to the car and burst into tears. And if you don't handle your metabolic health, and all that inflammation and bad diet and everything, you dramatically increase the risk of developing dementia. So anyway, What else did we do with those stem cells? God, I saved the dog. I had a dog that had kidney failure. You remember that?
Yeah.
Teddy. That was, man. So Teddy had this congenital kidney disease, but we also think he might have consumed some ethylene glycol, like radiation coolant.
Right.
May have licked it off the ground or something. I don't know. He was a little puppy, and the vet said, you should put him down, which was fine by me as a biologist, but the family were like, Dad, do something. And so I convinced the vet to work with me on this world first stem cell treatment of this little puppy dog. We put him under general anesthetic and cut him open. And dogs have a fair bit of fat tissue that just sits on top of the liver. So we excised that fat and stole some fat from around his testes, the epididymal fat. And we got about 15 grams of fat. And I set up a makeshift laboratory in this vet clinic, Southern Cross Vet Surgery in Petersham or somewhere. Sam is the doctor. I can't remember his last name, but awesome guy. Best vet ever. Anyway, we treat the dog. We injected the cells into his hind limb, into a vein, in the hope they'd go to his kidneys and regenerate function. And it freaking worked. And it got better. Clinically, you would never know there was anything wrong with him. The vet, all his blood chemistry is corrected. The vet was like, man, this is about as close to a miracle as I've ever seen. He thought it was all voodoo stuff, but he was curious enough to play along with me. It was amazing. The dog lived for another 3 years or so, and unfortunately he passed away. But I didn't get to do the bloody autopsy on the dog, because, it wasn't in my care anymore. But would have been interesting to see what happened to his kidneys after that.
And do the stem cells move around? Because I know when I had my knees done, I had a similar thing with my shoulder from motorbike accidents and stuff, where if I was, say, walking with Lan next to me and I'd go to put my arm up next to her or around her, as I'd lift my arm up, it'd just buckle me over and I couldn't do it. I'd have to put it back down again and then sort of move it around and bring it up. And within the same sort of time, my knees were getting better. I've never had that issue with my shoulder ever since.
We didn't inject your shoulder?
No.
No, it was just your knee.
Just knees.
Well, look, it could be a number of factors. It could be the influence of the stem cells. It could be like maybe there's some growth factors that circulate, although we inject in your knees, who knows, right? It may also just be the musculoskeletal system correcting in your knees that, see, muscles aren't linear. My anatomy is terrible. Yeah, exactly, right? So my view of anatomy, which I hated studying, it's very linear. It's just like the muscle starts here and it ends here. It's just not in reality, right? The major muscles, they're pretty obvious, but you get all these other musculoskeletal structures and soft tissues, and it kind of wraps around, and stuff that happens, you injure your right ankle and it messes with your left shoulder. And I'm not an expert in all that sort of stuff, but I've seen enough of it to just be so fascinated with it. It's so damn complex. So that may be that, when your biomechanics corrected and there was no longer the pain and you started moving differently, maybe some stuff, who knows? The same thing happened with another doctor who we trained to do these treatments, and he injected a patient's knee, and same thing. She had frozen shoulder that then freed up, and she was like, how does that work? He's ringing me at 11:30 at night. How does this work? I'm like, I don't know. Is she better? Yeah. I'm like, okay, good stuff. Can I sleep now? I can't explain it. Right? It's like the Panadol. You don't know how it works, but it just works. So take it, right? So these cells are amazing, and I've had them injected into my left knee and my right wrist and that knuckle, and I even had some injected into my vein just to prove to the doctor that you don't die. The cool thing about intravenous administration of these stem cells, which is it's in the news now because Mesoblast is, they're doing some amazing stuff with COVID, advanced COVID patients, and 83, 87% success rate in those that were pretty much screwed. It's fixing them. But we've always known this, because you inject the cells into your vein, 90% of them get trapped in your lungs, and
Right.
they're very anti-inflammatory. So they'll bring that acute respiratory distress syndrome, the cytokine storm, they'll settle that down. That's what these stem cells do.
Yeah, right.
But then, in addition, they can also help the healing process. So you don't get all the scarring that you might otherwise have gotten from the viral infection and all that tissue damage.
Yeah.
So unbelievably powerful, and they can be used for chronic obstructive pulmonary disorder, asthma. I've had colleagues in the US have used to inject. They've invented these disposable catheters. You go right up into the heart, patients with congestive heart failure, and you can inject micro injections, the stem cells, into those sites of tissue damage.
Wow.
And they've done some cool stuff with that, and it's increased the injection fraction by 13% and increased the 6-minute walk test by like the length of a football field. And
wow,
this is unbelievably, way more effective than the gold standard drug therapies.
Can it still be done here now, or is it pretty much been?
Fuck no. You think device and pharmaceutical companies are gonna let this shit fly? No way, man. Of course not. There's too much money in that industry.
How do people do this?
I don't know. You go to Panama, or I don't know. But here in Australia, what we've been able to do is, because look, the Therapeutic Goods Administration have put down the constraints within which we can do certain things and we can't do certain things. And we figured out how to make it work. So we're using a particular technology now where we can make these regenerative type of reparative, restorative medical approaches available for people utilizing, their own body's healing powers, to increase joint mobility, decrease the pain, hopefully prevent the requirement for total joint replacement surgery. So, we've created a new company called cellgen.com.au. People could check it out or reach out to me and ask questions. And so I think we're ready to go. So, and it's all within the boundaries of what the government's allowed, and the device that we're using, the technology, is cleared by the TGA, it's cleared by the FDA, and we can use it to treat orthopedic conditions now. So it's been a long road, but I think, we're getting somewhere, and, you just got to learn the rules of the game and play.
Take those.
Frustrating, but,
Yeah, for sure. All right, cool.
Yeah.
Well, that was pretty interesting. Anyone that's reached out and asked about my knees before, and I know a lot of you have, and is sort of dealing with any of those things, get in contact with Dean and find out what's available, and hopefully get something done about it before you need to.
Yeah, just for orthopedic conditions, we'll maybe talk another time about regenerating hair. What do you reckon? Imagine us, and we've regrown our hair.
6 months later, on Chewing the Fat, we've just got like afros.
Big mops. You can transplant your pubic hair to your scalp.
Oh, no, thanks. You're a real dickhead.
But, it's interesting. There's a correlation between, there's a layer of fat under the skin,
right,
on your scalp. And as that fat decreases, it correlates with hair loss, male pattern baldness in men. So, I've got, pictures of on my phone, colleagues that have used the fat-derived stem cells, injected it into the scalp, combined with the platelet-rich plasma. They've regrown the bloody hair. It's amazing. So, all this stuff's possible.
I don't know if I'd want hair again. It took me years.
People wouldn't listen to me if I had hair. I think because I'm bald and I look like a Shaolin monk, people think that what I've got to say is like somewhat profound. And
people see photos of me with hair after they rag me for being, baldy, and then they go, Yeah, wow. I actually like you without it better. Way cheaper on haircuts too. 5-minute shave with the old Aldi 4-blade.
Aldi 4-blade.
Lasts way longer than the Gillette Mac 3s.
Oh, really?
Way cheaper. Yeah.
I'll start doing that. I'm wasting too much money, man.
Oh, they cost a ton, those Gillette things. Yeah, the Aldi, I can't remember that. I'll send you a pic of them. They're the gun razors. They last way longer and they shave closer too, I reckon. There you go.
I remember the first time I ever shaved my head. Do you remember the first time you shaved your head?
Yeah, for like
how that felt?
Leather.
It was amazing. Didn't even feel like it was my head to touch, you know?
Exactly right.
Anyway, we've gone way off track with this conversation.
Way off track. But hopefully someone's picked up some tips either on, mobility issues with themselves or going bald, shaving their head, and which razors to buy when you do so.
Exactly.
Thanks for tuning in, guys.
Reach out if you've got questions.
Yeah.
Happy to chat.
And we'll talk again next week. See ya.
Look forward to it. Take care, man.